Hi, I'm Kyle Malone from the Medical Affairs team, and I'm here to talk to you about spine fundamentals. By the end of this video, you will be able to recognize the three anatomical planes, identify basic medical terminology, and describe the main regions, functions, and curves of the spine. A plane is a real or imaginary flat surface. Anatomical planes are used to transect the human body in order to describe the location of structures or the direction of movements. There are three anatomical planes. The coronal or frontal plane divides the body into front and back sections. The sagittal or median plane divides the body into left and right sections. And the axial or horizontal plane divides the body into upper and lower segments. Anatomical orientation and directional terminology is important in the medical field because it ensures surgeons have a common method of communicating, as well as helps to avoid any confusion when identifying structures and locations. The following are terms you may hear your surgeon use frequently. Superior is defined as the upper part or above a specific location, while inferior is defined as the lower part of the body or below a specific location. Medial means toward or at the midline of the body, while lateral means away from the midline. And finally, proximal means closer to the core when referencing position along an extremity, and distal means further from the core. You may hear the term cranial when referring to the head or towards the head, and caudal when referring to the tail or towards the tail. Anterior means the front section or towards the front. The term is synonymous with ventral, which also means the front or anterior surface. Posterior refers to the back section or towards the back. This term is also synonymous with dorsal and refers to the back or posterior surface. Now we are going to dive deeper into the spine, the regions, curves, and overall function of the spine. The spine is made up of 33 individual vertebrae which form the spinal column. The vertebrae are numbered and divided into 5 regions. The cervical region has 7 cervical vertebrae numbered from top to bottom, C1 to C7. The thoracic region has 12 thoracic vertebrae numbered T1 to T12. The lumbar region has 5 lumbar vertebrae numbered L1 to L5. The sacral region of the spine contains only the sacrum, a single bone in the adult skeleton that is formed by the fusion of 5 vertebrae during adolescence. The sacrum is a flat, triangular bone found in the lower back and wedged between the 2 hip bones. The spine's coccygeal region contains only the coccyx, a single bone in the adult skeleton that is formed by the fusion of 4 smaller vertebrae during adolescence. The coccyx is often referred to as the human tailbone. An easy way to remember the number of vertebrae in the main regions of the spine is you can eat breakfast at 7 a.m., lunch at 12 p.m., and dinner at 5 p.m. The spine is one of the most important parts of your body and serves a number of purposes. The 3 most important functions of the spine are: Number 1, protection. The spine is designed to protect your spinal cord, nerve roots, and internal organs. Number 2, structural support. Without the spine, you could not keep yourself upright or even stand up. It gives you balance and supports your body's weight. And number 3, flexibility and mobility. The spine allows you to move forwards and backwards, also known as flexion extension. You can bend to the right and left, known as lateral bending, and you can twist left and right, known as axial rotation. Again, the 3 most important functions of the spine are protection, structural support, and flexibility and mobility. Now let's learn about the curves of the spine. Curves are important to spinal balance, flexibility, and axial loading. The normal spine has an S-like curve when looking at it in the sagittal plane. This allows for an even distribution of weight and effective muscle movements. There are 2 types of curves in the sagittal plane. The cervical and lumbar regions have a lordotic curve where the apex points anteriorly. The thoracic and sacral regions have a kyphotic curve where the apex points posteriorly. In the coronal plane, the spine is straight. And that's it. You now know the anatomical planes, basic terminology, main regions, functions, and curves of the spine.